Hello everybody. Welcome to First Friday for February 2018. I hope your year has started out well. January is always very slow for me. And it's sort of a good time to look back and reflect on the prior year and make plans for the new year. So I hope you've had a chance to do that as well. I wanted to give you a couple of things that I'm kind of excited about that have been in the news recently. And the first one is I want to give you an update on the mandate. So an update on the Affordable Care Act individual mandate. As you know, Congress had failed to pass any kind of repeal and replace for the Affordable Care Act, or as people call it, Obamacare, although you know by now that I don't like to use that term because it's not correct, not a proper name for what it is. But back in December of 2017, Congress did pass a tax reform bill. And they tacked on to the tax reform bill a repeal of the individual mandate that was a part of the Affordable Care Act. That mandate required all Americans to have some form of credible, according to government standards, health insurance. So that could be through a person's employer, it could be through the government like with Medicare or Medicaid, which is TennCare in Tennessee, or through the VA for veterans. Or an individual policy that had been purchased in the individual market. And as we all painfully know now, the individual market has deteriorated to the point where, in Tennessee anyway, there are only 2 health insurance companies still offering coverage on the federal marketplace, and there is no health insurance offered in the free market that is credible or matches up to the requirements that the government deems that they have to meet, those 10 essential benefits. So it came down to you either have to get one of those 2 plans on the federal marketplace, or you had to get a non-compliant plan and pay the penalty, or you would get a plan from a faith-based organization. So that kind of brings you up to where we are and the whole situation with the mandate. So the tax bill repealed that much-hated mandate, and it really took the teeth out of the Affordable Care Act, because without a mandate that required people to have health insurance, then they won't do it if they can't afford it, which is the case for a lot of people. They can't afford $800, $1,000 a month for health insurance, and so it is much cheaper to pay the penalty, so they're just going without. So that was very exciting that the individual mandate has been repealed. Now, in the State of the Union message on Tuesday night, it was mentioned that Congress had done away with the individual mandate. And that is true, except that does not begin until 2019, till next year. So at the current time for 2018, the individual mandate still stands, and if you do not have credible coverage or coverage that the government deems to be what they want you to have, then you will still pay a penalty if you do not have that type of coverage for more than 2 months. And that penalty for 2018 will be paid on your 2018 taxes that will come due in April of 2019. So yes, the individual mandate has been done away with, but we're not quite there yet to see that completely gone. What I am excited about, though, and something that my husband and I had been chatting about during a walk around the track at the local gym, is what I'm seeing going on in the free market. And I think the repeal of the individual mandate has kind of got people thinking about perhaps some other ways to get around the regulations that are put forth in the Affordable Care Act, since it seems that Congress can't seem to get their act together and come up with a reasonable plan. So, as Americans always do, we come up with innovation and let our free market do what it does best, and that is come up with other options. So, what I saw last year coming down the pike that probably other people may not have seen or understood the significance of was what was going on with CVS Pharmacy. CVS Pharmacy very quietly removed tobacco products from their drugstores. And this was a signal that they are moving toward a wellness kind of health based philosophy. They already have the in-store clinics, the minute clinics at a great number of their community pharmacies. And so now they're shifting, and I also read that they're making some additional requirements to cosmetics that they place in their pharmacy as well. So all of this is a move toward wellness. Then late last year, they acquired the health insurance giant Aetna. Aetna is the third largest health insurance company in the United States. It is a national company, so it is across the entire 50 states. This is really interesting news because being an insurance agent who represents Aetna, at least in the Medicare market for the moment, it was interesting to me because they put out some announcements after this merger went through saying that they were going to develop community health centers. And so I think that really creates an opportunity for some unique situations. There you've got a pharmacy with an emphasis on wellness. They've got a doctor in the store, or at least a nurse practitioner. They're already providing those kind of health services in the store. And now they've acquired a health insurance company. And so stay tuned for that, because I think we're going to see some very interesting developments come out of that CVS-Aetna merger. Then, on top of that, and this is what my husband and I were talking about as we were walking last week, is the announcement that's got quite a bit of news between Amazon, Berkshire Hathaway, and JP Morgan. and the announcement that they're going to form some kind of conglomerate and get into the health insurance market. And they said that it was for employees, or it was going to be, but with that information on top of what I was already thinking was coming with CVS Pharmacy and Aetna, I think we're really seeing some innovation here in the market. And I know the stock market was a little worried about it, and I know people get a little worried, and they're afraid that these big companies are going to circumvent providing something that's good for the society. And let's hope that's not the case, and let's hope that the American spirit is alive and well here in health insurance. We certainly need some good news in that arena. I really miss selling individual health insurance. I'm only doing Medicare products at the moment because in the individual market, since there was basically no demand for that product anymore, the companies stopped paying agents to do that work. So I really have missed that. I miss the interaction. I miss the helping customers find plans, and now I am cautiously optimistic that perhaps there is still hope for a truly free market that will keep the premiums at a reasonable rate where people can truly afford them, but still keep an element of that fairness that we've seen, where sick people are still able to get health insurance in some form, and still provide quality health insurance to Americans, but give them back their opportunity to choose what they deem to be affordable to them, and also the kind of coverage that they want for themselves and their families. And so I'm optimistic. I'm dreaming of a day when we might have something new in the market. So feel free to leave me some comments below and ask me some questions. And I hope that you've enjoyed this edition of First Friday. And until next time, I'm Wanda Holt with Holt Health Insurance.